Hello, my name is Vim Bai. I'm an occupational therapist. Welcome to my talk on analysis in the neuroscience of learning. I'm going to talk about the cognitive development and learning of a child. I will discuss the infant stage, which will be the 0 to 1 year old, the toddler stage, 1 to 3 years, and the preschool stage, 3 to 6 years. According to the Centers for Disease Control, and I'll refer to it as CDC and prevention, a child develops at their own pace. There is a wide window when it is normal for a child to reach a particular developmental stage. The question is, how does the brain function, and how can we as health practitioners influence how children or clients learn? Patterson in 2006 stated that there is a link between change in brain structure and cognitive performance. The science of learning is an interdisciplinary field of the hard science of physiology and chemistry of the brain function and the science of learning rooted in behavioral science. The development of brain imaging has allowed scientists to examine behavior and measure brain activity concurrently. Increased brain activity in certain areas can be correlated to certain behaviors. Patterson in 2006 described the maturation of the brain. The rate of maturation of white matter in cortex reflects increased myelination, which in turn results in faster information processing. Myelination begins at the base of the brain at birth. Between 8 to 12 months, the frontal, parietal, and occipital lobes get myelinated. It follows infants whose brain development is more advanced in terms of myelination may attain cognitive abilities earlier than their age mates with less developed myelination. I will discuss some of the domain areas as discussed by Patterson of child development. These domain areas are attention, object permanency, and face processing. Patterson reported in 2006 that attention in infants develops from a simple orientation response to mature executive functions. An infant develops joint attention associated with attention shifting capacities in the 4 to 6 months. According to the video, a YouTube video by Babies and Bones in 2019, an infant can attend and watch a caregiver move. Joint attention is the ability to coordinate attention with another person. This ability is important for social cognitive skills. According to the CDC, babies have developed that skills as they look at adults at 4 months and make sounds to get attention. Acquisition of object permanency is another milestone that is a precursor to later executive function. Object permanency is keeping track of objects even when they disappear from view. Patterson 2006 reported. The maturation of the frontal lobe plays an important role in development of object permanency, which according to the CDC appears between 7 to 9 months, which correlates with an increase in the association of frontal association cortices. 9 months is the time reported by the CDC when a child looks for objects dropped out of sight and plays peekaboo. Sampaio and others in 2014 indicated that an infant prefers human faces. Behaviorally, infants show preference for faces shortly after birth, and by 2 months, an infant smiles when talked to, according to the CDC. Face processing is an important skill to promote social interaction. At 9 months, the infant is clingy and fearful of strangers because of their ability to recognize faces. This correlates with the development of the brain structure, the myelination of the frontal lobe between 8 to 12 months. Initially, the face stimuli is recognized in the subcortical structures. As the brain develops, the visual and cortical pathways are recruited. It's demonstrated by an infant being able to recognize a prototype. The ability to form close and secure interpersonal relationships is important for learning and cognitive development. A responsive caregiver encourages interaction with an infant, forming a secure bond with the infant. According to Sampier in 2014, a secure attachment style favors exploration of the environment. Harlow in 2021 reported the attachment theory by John Bowlby, which states that infants' relationship with parents begin with the set of inert signals to the baby's side. Over time, it develops into true affection bonds. Early relationships quality will impact how one relates to others later as an adult. Secure attachment provides positive foundation for life. Indirect evidence of infant brain development has been associated with attachment-related brain regions around 8 months with cortical surface expansion. David in 2015 reported that infants develop a sense of understanding of self and others around 9 months. According to David in 2015, the separation individuation theory of child development by Mahler focused on the mother-infant interaction with the series of stages occurring within 3 years. Separation refers to mental separation from the mother, and individuation refers to developing a self-concept. The infant transitions from an internal focus to an external focus. 0 to 1 month, the mother is viewed as an intrinsic part of the infant. 1 to 5 months, the infant acknowledges the mother's existence as a source of need satisfaction and not as a unique entity. 5 to 24 months, the infant views the mother as an individual. Separation and individuation are important to promote autonomy, independence, and identity. I learned how changes in the brain structure correlate with changes in child development. What I would like to learn from the video by Birth and Bones in 2019 is what to do if the infant is showing signs of developmental delay. I learned how positive, secure attachment between caregiver and infant is important to promote learning and impacts how one relates to others later in life. Milestones reflect an interaction of child's developing neurological system with its environment. According to Dossman and Andrews in 2012, toddler age is marked by contradictions. The child seeks independence but shows increased separation anxiety and fear of previously accepted situations. David in 2015 wrote that according to Mahler's separation individuation theory of child development, the child desires independence but fears abandonment. The child seeks to be close to the caregiver while exploring the environment. According to the CDC, the toddler stage is marked by tantrums, which can be explained by the child being torn between independence and fear of being away from the caregiver. An article by Dossman and Andrews in 2015 reported that at 2 years old, language develops exponentially. The child understands symbolic representation as evidenced by pretend play. The CDC reported that a child at 30 months can say 50 words. Joint attention, which emerges at 9 months, is important for language development. Early deficits in rapid auditory processing are at risk of language impairment, and it is also important for language function. Patterson in 2006 indicated that multisensorial integration, which depends on the maturation of the specific neuromotor networks in parallel with specialized brain circuits, are strongly associated with cognitive, emotional, and language skills. Brain areas related to language-related tasks are extensive due to the complexity of the tasks. The area includes the superior temporal gyrus and the left inferior frontal gyrus. Object permanency is established at 3. It means remembering people for long periods of time. That explains why the 3-year-old child is more relaxed during separation than a 9-month-old infant. According to David, 2015, the separation individuation theory of child development states that the child unconsciously has a mental model of the mother even when physically separated. I learned from the video by Tresilian family care centers that during toddler years, temper tantrums are not just uncontrollable emotions, but children trying to regulate their emotions who need a secure environment to explore and learn. I would want to learn more about the availability of community resources such as early intervention programs or mental health services to refer toddlers having problems in development. According to Zelazzo and Carlson in 2020, executive functions develop rapidly in preschool and early adolescence. Executive functions are necessary for academic achievement and are important for math. Executive functions are conscious top-down attentional control of thought, action, and emotion. Scaffold opportunities to practice executive function promote development. Zizalo and Carlson of 2020 noted that neuroimaging indicated the common areas are frontal-parietal control and dorsal attention networks. Studies has found that early executive function skills are stronger predictors of later math skills. Repeated engagement in problem solving and increasing the level of challenge strengthen the skills and increases efficiency and corresponding neural circuitry. Zelazzo and Carlson in 2020 noted that socioeconomic status of children's families impacted their executive function. Children from families with higher income and parental education perform better on executive functions. The socioeconomic related difference were reflected in the brain structure and function, with atypical prefrontal cortical activity in low socioeconomic infants as young as 6 months. This Montessori method is a prominent preschool educational philosophy view that emphasizes self-study and teaching by senses, according to Bahami and others in 2015. A child acquires skills through observation, simulation, and exploration. The approach teaches problem solving, and the role of the teacher is to guide and correct the child. Educational tools allow immediate feedback. Education content is based on on what the student identifies as necessary. Self-assessment, self-correction, self-teaching method, and learning continue until the student acquires considered competence. Research by Cayley and Ari in 2011 examined the effects of Montessori method on children's readiness for primary education, and results found that the method positively contributes to the preschool children's readiness compared to the control preschool education program. A study by Ansari and Winsler in 2014 did not have positive results using Montessori curriculum with children of low income from Latino and Black communities. Black children showed slightly better gains when using more conventional programs. I learned that the findings have implications for tailoring early childhood programs for Black low-income communities. I also learned that interventions targeting executive functions in children for low-income socioeconomic families need to address the social determinant factors. I learned that the Montessori method could be applied in my clinical area in the care of older adults with dementia. A systematic review by Shepherd and others in 2015 found a strong level of evidence for the benefits of Montessori-based activities on eating behaviors and weak evidence for the benefits on cognition. Evidence on Montessori methods is mixed. Future research is needed to investigate the long-term benefits of Montessori-based activities in older adults with dementia. I learned from a video by Dr. Al-Bakir in 2021 that things caretakers need to watch out for and make a referral to a healthcare provider if the child is showing signs of maladaptive behavior. The Preschool Development Guideline for the National Institute of Health Library reported that although 4 to 5-year-olds start to play games, the rules of the games are likely to change at the whim of a dominant child. I am going to conclude my talk, and there is a link between the changes in brain structure and cognitive performance. Infant attention and object permanency development continue to develop as the brain develops and influences executive functions in childhood and adulthood. A secure attachment style in infancy provides a positive foundation for life and promotes child development. The Montessori method of preschool education can be applied to the care of adults with dementia. Thank you. And here are my references.